Hi everyone, my name is Angel and my topics include pathophysiology, clinical manifestations, and diagnostic tests for renal failure. Kidney or renal failure refers to significant loss of renal function, which can be acute or chronic. Acute kidney injury is a sudden decline in kidney function. This can be categorized as pre-renal, intrarenal, and post-renal, and usually accompanied by oliguria with elevated BUN and plasma creatinine level. Pre-renal can start from hypotension, a decrease in blood volume due to hemorrhage, or fluid loss that can happen to burn cases, sepsis, inadequate cardiac output, or any situation that can decrease circulating blood volume, as this can result to decreased perfusion of the kidneys. Decreased perfusion can result to decreased glomerular filtration rate, or GFR. Decrease in GFR automatically adjusts the reabsorption rate of sodium in water, primarily in the proximal convoluted tubule, to balance change in GFR. A low GFR also increases reabsorption of blood urea nitrogen, or BUN, as well as creatinine. To keep the rate of glomerular perfusion, autoregulation of intrarenal blood flow and tubuloglomerular feedback mechanism happens, as mediated by angiotensin II, stimulating increase in release of aldosterone and antidiuretic hormone, which results in increase of sodium and water reabsorption in the distal tubule, thus resulting in oliguria. For intrarenal acute kidney injury, the most common cause is ischemic acute tubular necrosis, which 40% to 50% cases occurs often after surgery and severe sepsis. Persistent hypotension leads to hypoperfusion, causing ischemia. Flow within the tubules is obstructed by casts comprised of shed epithelial cells and necrotic debris. This then increases intratubular pressure as it prevents fluid flow, causing fluid to back up, decreasing GFR, as well as urine output. Post-renal acute kidney injury is rare. This usually occurs with urinary tract obstruction that affects the kidneys bilaterally. Obstruction may be due to obstructive uropathies. Urethral destruction may be due to edema or tumors. Bladder neck obstruction like enlarged prostate or neurogenic bladder. This obstruction causes intraluminal pressure that may trigger release of inflammatory mediators and vascular endothelial cell injury. This then leads to renal vasoconstriction, cellular edema, decrease in glomerular filtration pressure, thus results to oliguria.